Hello, everybody, and welcome back to Valley Life. I'm Rich Krebs. As much as I love to show you a beautiful facility that Affinity Dental has to offer, I thought we'd drop in today on another special service that Dr. Michaels does. Dr. Michaels, how are you, sir?
How are you?
I'm great. It's good to see you.
Good to see you.
Today, we've kind of bombarded here Central California Blood Bank, and you're doing oral cancer screening. Tell me a little bit about that.
Well, we do this as a community service, but years ago, I had a friend who had a small lesion on his tongue, and he never had anybody look at it or take care of it.
Okay.
Eventually, he had to have half of his tongue removed. And ever since that day, I've wanted to be sure that our patients are checked for oral cancer, and we come out and do this as a community service.
Sure. And look at this. Speaking of friends.
You are the guy who's going to need to be checked.
You know what? You're right. Hi, doctor. How are you?
Look at that thing growing right there.
Yeah. It's a mustache.
So apparently, I'm great, sir. How are you?
You know, I'm doing great. You know, and I know how important it is. You know, it's part of your total health picture. And you know what? Sometimes we overlook a few things. And of course, with the statistics that the doctor has been talking about, that we know about oral cancer, it's really important. So you got to take the time to make sure you get checked up.
Sure. Well, Dr. Michaels, you invited Kopi down then so you could kind of show people that, look, it's nothing to be afraid of. And it's an easy thing that needs to be done.
It's easy to check. And the interesting thing is that one person every hour in the United States dies from oral cancer.
It's staggering.
It's huge. I had no idea until I looked into it. And 80% of all the oral cancers are completely preventable if you have early detection.
Well, are there symptoms that people should be looking for that, they notice right up front?
Usually not.
So screening is the way to go.
Screening's the way to go. If you smoke, you're at a high risk, for sure. If you drink a lot of alcohol, you're at high risk. The other scary thing is that 25% of all oral cancers, they can't find any reason for them. They just show up.
Sure.
So we're here today to do cancer screenings.
Well, Dr. Michael, speaking of another business that actually is giving back to the community or doing great things for the community, Mr. Dean Eller, how are you, sir?
Good, thank you.
Well, talk to me a little bit about the blood bank and how people get involved. You have built a beautiful facility right here. It's very easy for people to come in, take advantage of it, donate, and you've also got some great mobile units.
Yes, we do. In fact, we really make it convenient for people to donate and give the gift of life. We have 6 blood mobiles. They're out in the 5-county area in the Central Valley every day, and so there's really we really make it convenient for people to give. Sure. We do have a new facility here. It's our new corporate headquarters and state-of-the-art testing lab. We have absolutely the safest blood in the country.
Kobe, were you apprehensive to come in today for this test?
You know, you're always thinking about, oh man, a test. And what worries you are the results a lot of times. And sometimes you don't want to know, but it's important. And I'm really not worried about taking this test because obviously we're in good hands, and it's important. It's important to find out because, like the doctor said, one person every hour dies from this. That's unbelievable. Right. So it's real important.
Okay. Well, Doc, then that being said, what does this test entail and how long is this process?
It only takes a couple minutes. You swish around a liquid in your mouth, spit it out. We use a special light, have to turn out the lights, and this liquid that you're swishing around will stain cancerous tissue, precancerous tissue. And so when I look with this special light, you do it.
Okay. Well, Kopi, you ready to make this happen?
I'm ready. All right, here we go.
All right, let's go. Go. Tina, give me some gloves. Okay, Kofi, why don't you go ahead and spit that out. Tina, you want to give me the...
That was good.
You like that?
Yeah. I love pickle juice.
All right, so what we do is break this,
Okay.
and you see it turns it into ultraviolet light.
Right.
And then we put it in here.
Star Wars.
Yeah, kind of like a saber.
Yeah.
Push it in. And then I like to stand on this side.
Okay.
And we turn out the light. And what you do with this is you look in your mouth, and it will allow us to see any lesions at all. And I don't, you know, for an old guy, you're actually looking pretty good. Oh, actually, everything Kopi looks really healthy. I'm gonna Stick your tongue out.
Ah.
Okay, move it to one side. That's good. Move it to the other side. Here, no, don't do that. Okay, you're looking great.
Thank you.
You have nothing in there.
Wonderful.
You're taking good care of yourself.
Well, we try our best.
And by the power of the living and TV, we're back. Kobe, that was painless.
It was painless, and the good thing is it was quick, painless, and you find out right away that I'm okay.
Sure. And Dr. Michaels, you had mentioned, doing something.
He's okay. Mentally, I'm not so sure.
We'll deal with the frontal lobotomy a little bit later.
I don't do those, but I could refer him somewhere that might be good.
Perfect. But you talked about, if people call you, you'll go out and do this anywhere in the community. It's a great service you're offering.
Glad to.
Just pick up the phone and call Affinity.
Give us a call and we'll schedule it.
So what are you waiting for? Hearing those numbers that are staggering, one every hour, why not just take the test? It's very quick. It's painless. You only have to do it once every couple years.
Yeah.
And then you know right now, so that way if you catch it early, 80% are treatable, and you're back to the healthy, happy lifestyle that you're shooting for. Don't go anywhere. There's more Valley Life coming up right after this.